Hello everyone, this is Dr. Sneha Shetty, Clinical Director, Chief Fertility Specialist, Laparoscopic Surgeon at Vriksh Fertility at HSR and Whitefield, Bangalore. Did you know that one single sperm can create a baby? You need not have millions of sperms. That's the power of the procedure called ICSI, that is Intracytoplasmic Sperm Injection. ICSI is a procedure which is a part of our IVF process done by the embryologist, a senior embryologist who selects a single best sperm and injects into the egg. This is usually done when the sperm count, sperm motility is very low. This method has helped millions of couples to achieve their dream of parenthood and have healthy, happy babies. Now, is ICSI always the best option? Not necessary. It depends on several factors which we assess prior to your IVF procedure, which involves assessing the sperm quality and the sperm quantity, which can be assessed by certain simple tests like your semen analysis, like your sperm DFI and your hormone assessment. If your doctor is doing it in the same cycle, which we call as a fresh embryo transfer, it is done after 3 to 5 days of your egg pickup. Or if it is a frozen transfer, then they may call you back next cycle once you get your periods. Now, what are the signs that ICSI treatment has worked? And do you require any bed rest after this procedure? Some of the early signs of a successful ICSI treatment is mild cramping, mild spotting, which may indicate implantation bleeding or spotting. Number 2 is nausea, bloating, and you may also experience certain breast tenderness. Now, is bed rest required? Absolutely no. Complete bed rest is usually avoided. Light activity is okay, but avoid lifting heavy weights, strenuous exercises, etc. Now, how do you improve the ICSI outcome? Number 1 is by optimizing your egg and sperm quality. Make sure you eat a healthy, well-balanced diet. Avoid alcohol, smoking, excess caffeine. Number 3 is that you make sure you take supplements which your doctor has recommended, which may include certain multivitamins, CoQ10, etc. Step number 2 to improve and optimize your ICSI success is to choose the right clinic and the right doctor. Make sure that your center which you're selecting is a central government ART registered center. The doctors are well qualified and have an in-house embryologist who takes care of your embryos and follow the latest protocols and have everything as per international standards. Third thing what you can do is improve your uterine receptivity by making sure you incorporate acupuncture treatments into your treatment. This helps improve the blood flow to your ovaries. Also, try to maintain a healthy weight and reduce your stress by doing certain mindful activities like yoga, meditation, etc. Step number 4, to improve your success rate, you can also try using genetic testing, which we call as pre-genetic testing of embryos. This helps to select the best embryo for the transfer, which is free from any chromosomal or major genetic problems. Now remember, a personalized approach to this ICSI treatment is the key here. Your doctor is going to be the best person who is going to discuss how to improve your chances and how you can get the maximum success out of your cycle. This depends on case to case and it depends on several other factors as well. Stay informed, understand the process, optimize your health in order to have the maximum success.